Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Josh here with us today, and he's actually a Houstonian that has been suffering from acid reflux and hiatal hernia for how long now?
10 to 15 years.
10 to 15 years, and you've done all the medical treatments and the Prevacid and Prilosec and all that stuff?
I've seen numerous doctors. I take Prilosec twice a day, and I got to the point where I can't stand taking it anymore.
And nothing was really helping it either.
Nothing was helping.
Yeah. And then you saw us on a YouTube video, right?
Correct, yeah. I watched a YouTube video, and it looked great, and at the end of the video, I said, if only this guy was in Houston, I'd be set.
And then this is your Houston chiropractor. Here we were. So now here's Josh right here, and this is Advanced Chiropractic Relief, and we're going to show you how we treat Houstonians the same as we do people that drive all over the country or from around the world to come see us for this. Let's take a look at you here, Josh. I'm going to have you flex your head forward and then backwards for me, please. Neutral. You got better range of motion too. Now, oftentimes associated with acid reflux or hiatal hernia or GERD, all those go together really, gastroesophageal reflux disease, you'll see biomechanical improprieties throughout the spine, including mostly the thoracic spine and the rib cage. And when we're analyzing his posture, we see his head's a little bit forward, which most people have. That's called forward head posture. His ear's dropping right here in front of his clavicle when it should be back here over his shoulders. Now you can see he's a side sleeper too, because his head's turned a little bit left of center, plus his head's translated to the right, which elevates his left shoulder blade a little bit. And then down here, he's got a little curve in his spine, right in his mid-thoracic spine region, which the mid-thoracic's attached to the rib cage. The rib cage is the attachment for the dome or the diaphragm that separates the lower cavity from the upper chest cavity. So when the diaphragm gets weak because of subluxation or misalignment in the mid-thoracic spine, the stomach then slips up through the hiatus and secretes acid into the esophagus and goes all the way up into your throat. And it was going all the way up into your throat and causing you to have hoarseness and raw throat and everything, huh?
Yep, absolutely.
And you can see how his hands are still a little bit out in front of him at this point, so we still got some work. This is only his second visit, by the way. So we got a couple more things here I'm going to look at, and then we're going to do y'all's favorite here, the manual spinal decompression first. Alright, let's lay you on your back here first today. And let's slide down this way just a little bit. And most of the people that come in here from YouTube feel right at home immediately because they see everything that's in our office on YouTube. And this is our office, so we do everything just like we do in our videos here. So what you see is what you get. Has that been pretty much true for you too, Josh?
Absolutely.
Everything you watched on YouTube, we've been doing
no,
to you, right?
No surprises.
No surprises, that's right. Oop, yeah, I know you guys have been telling me about my squeaky table. I need to get WD for you. Okay.
We know we have that here.
I know. Now, I'm going to have you keep your teeth together for me, Josh. Take a deep breath through your nose and just let it all out and relax everything. Oh, yeah, boy, that was a home run. Felt that all the way through, didn't you? I call that my ring dinger RD. Back in the dark ages, they would call this the rack. Then we're going to do a Palmer diversified cervical rotary brake on his cervical vertebrae. Perfect, good job. And Renee's getting really a lot better at doing the producing and videography on these things. So for all you crack addicts out there that like hearing the pop noises, she's trying to get closer so you can hear those. Okay, so let's come over here on your tummy now. Let's kind of get up sideways. Yep, perfect. And I'm going to lay you on your tummy with your head a little bit forward there, Josh. So we always check the leg length, and he has a right leg that's about a ½ an inch shorter than his left leg in the prone position. Now when I bring it up, it actually gets longer, and that tightens up in your lower back right there, doesn't it?
Yes, yeah.
So that's called a positive Knockless and Deerfield test on the right, because his pelvis raised up in the air and lumbar spine got tight and was more painful. And his right SI joint's out right there, and you see he's sitting on a wall over here too, which is only his second visit, so we'll let him slide on that one for today. But eventually, when he starts taking that out, putting it in his front pocket and doesn't sit on it, his pelvis will stabilize quicker. Men in their wallets and women in their purses. Women have to hike their shoulders up to hold their purses on. Men sit on their wallets all the time, which jacks their sacroiliac joints and pelvis bones out of place. So then we're going to adjust his sacrum in the S to I configuration right here, and the sacrum straight down in the Z-axis and the Y-axis. L5 will be straight down in the Z-axis. L4, that was pretty tender. There's L3, that was probably the most tender, huh? There's L3, or L2 I mean, L1, and now, I'm going to move in here. Excellent, good job. And keep breathing, exhale. Yep. We just continue moving on up the thoracic spine, okay? And his upper thoracics here. Okay. There, okay, I'm going to put your head down just a little bit more, see if we can open these joints up a little bit more. Okay. Acid reflux / hiatal hernia / GERD is in about 50% of the American population. It's a very, very common disorder. So 50% of you out watching this video will probably have had symptoms of heartburn or pressure under your sternum, acid going up into your esophagus, in your throat, bloated feeling in your abdomen. A lot of times that's accompanied by other gastrointestinal issues, sometimes colitis or gastritis. Sometimes the diagnosis on a lot of people coming in here has been gastritis with just inflammation of the stomach, when in fact their problem's actually caused by biomechanical segmental dysfunction in the thoracic spine and the ribs where they attach, and that makes the diaphragm weaker than normal, so the stomach slips up through there and starts secreting acid into the esophagus. Therefore, acid reflux goes up. Now I'm doing some deep tissue work in his paraspinal muscles, and there's different spots on every patient that'll be a little bit more sore than others. Now yours, you're gonna feel a lot of yours right in that thoracolumbar area right there. Yep. And a lot of times when I do this, you feel that way deep in your gut too, huh? That's called the somatovisceral reflex. And then when I pull the stomach down, that creates a viscerosomatic reflex that when you do all those combined together, gives us a good outcome for this problem healing up on its own. And I'm often asked, is this a permanent solution once you do it? No, it's not. You can't, there's no magic super glue that I found that will hold the stomach down through the diaphragm if you're doing something on a daily basis, like sleeping incorrectly or sitting at your computer station incorrectly with your head bent forward all day long, working out wrong with bad posture, and just not paying attention to your everyday biomechanics, which we teach every single patient how to sleep, how to sit, how to stand, how to walk, and even how to drive a car properly where it doesn't cause them to have the forward head posture leading to all these other spine-related disorders and also other conditions that develop like acid reflux. See, his legs are exactly even now, and as I bring him up, his pelvis doesn't raise up in the air and the legs stay even. I bet you that didn't hurt at all.
No.
Great. So, we haven't done the turbinator on him yet, so we're still going to do some deep massage percussion into his pelvic musculature, his tensor fascia lata, or IT band on the sides of his thighs, the hamstring, and all the way down into the calves here, which are probably a little sore too. Now, a lot of chiropractors' YouTube videos or commercials or testimonials, which I find quite boring actually. But here at Advanced Chiropractic Relief, we do all treatment videos on actual patient problems and conditions. And we do follow-up videos to show patients' progresses. So you'll probably be seeing Josh in a future video down the road talking about him running a marathon or something. There you go. See, now this may not look like much on the video, but I'm getting in here pretty deep in these muscles and stimulating these so that we begin getting the somatovisceral reflex stimulation. And the normal forward lordosis down the lumbar spine here we're working on. All the way up to these traps and levator scapular muscles and shoulder blades. Very good. People usually want to give me 2 or 3 hours to quit that. Yeah, perfect, and there should be no pain at all here. Great, good. Alright, so I'm going to check his upper thoracics right here. And he does have a little deviation right here at T1, T2, so I'm going to do a thumb move. Okay, now just relax your head right in my hand on this one. There it is, right there. Okay, let's turn you on your back now, Josh. Okay, so I've already adjusted his cervical spine in that position, so right now, we get on, find his sternum, we go all the way down to the end. Right down at the bottom, you'll find the little tip of that called the xiphoid process. You don't want to get on that. And you go below that, there's a soft spot there, so take a deep breath in for me, Josh. Let it all the way out, and then I dig down in there deep, but slowly grab the stomach, the top of it, and then I pull that down very deeply. You probably can feel that pulse on your aorta. There we go, another one. This is a lot deeper than it looks on there too, as Josh can tell you. Another deep one for me, one more time. And we do this 3 times in a row in succession, with them exhaling the entire way as I'm pulling the stomach down. And please do not do this unless you're a licensed healthcare provider. We get phone calls and emails every day from people all over the world wanting me to refer them to a chiropractor just like me in LA or New York or Miami that does exactly what I do. Well, there's not very many chiropractors that do the work on hiatal hernia just because they haven't had experience with it. But the reason I know so much about it is because I had a severe case of it myself. And when you've had a problem yourself, you can really empathize with your patients and you learn what to do to correct problems. I can eat jalapeno peppers right before I go to bed and still not have problems now. And the goals of a lot of our patients is just to be able to eat properly and eat, well, not necessarily properly, but double jalapeno pepperoni pizzas, for instance. And David, if you're watching this, you know who I'm talking about. We've got some patients' goals. There's, I want to eat a double jalapeno pepperoni pizza. That's their goal. And we've gotten them to be able to do that. And then when their patients come here from out of town, I always tell them to eat whatever they want and as much as they want while they're here, so that we can actually, go ahead and scoot up that way just a little. There you go, good. And watch your fingers. I don't want to smash your fingers on the table. There you go. There we go, good. Okay, now I'm going to check his knee stability out here. Got a little bit of laxity in the medial and lateral collateral ligament. There we go. You should have felt that in your knee and your back, did you, Josh?
Absolutely.
Okay. And there we go. Excellent. Should have felt that one settle. Good. Okay, let's sit you up sideways and face over this way towards your knee. There we go. There we go. This is right glenohumeral joint. And you know, people don't have to have pain in these joints for me to check them out and adjust them, because we literally adjust people in all the joints of the body that we can to make sure everything's functioning and working together. There we go, good. And left elbow. Oh yeah, that was a good one there. And people will oftentimes come in following these and say, you know, I haven't been getting that numbness and tingling in my hands and fingers like I used to, or my wrist isn't bothering me while I'm working on my computer like it used to, because those are sore right there. Yep. Okay. Renee and I would also like to thank all of you for subscribing, watching, commenting, and sharing our videos on YouTube. And Josh, would you mind sharing your story with them? This is a...
You know, I'd just like to say the main reason I came in here is I was having really bad breathing problems. I would say I would get short of breath just talking on the phone at work. Now, you know, after my second visit, my breathing is 50% better. Chest pain was another thing that I had. After my first visit with Dr. Johnson, I have zero chest pain. No chest pain.
Praise the Lord on that.
And another thing, which was kind of a secondary problem that I had, was lower back pain. My wife used to mention to me that every time I kneeled down, I would say, ow, every single time, and not think about it. But now I can kneel down, pick something up, and I feel great.
Yeah, I don't think about the ankle bone connected to the knee bone, connected to the hip bone. That's all true, huh?
Absolutely.
Everything works together.
Yeah, and I'm lucky that I live so close, but honestly, I would drive across the country to see Dr. Johnson. He's the best in the business.
Well, thank you very much for that. And thank you for sharing your story, Josh. Let's come over and shoot you now. Yeah, you say, what do you do when you go see Dr. Johnson? Oh, he pulls your leg and then shoots you. Okay, let's have you flex your hip forward and then backwards for me. Now this actually is retraining the cerebellum, which is the hindbrain. See how he's got still a little bit of forward head posture there. So we're going to have him do his exercise where he lifts up with his traps, pulls back with his rhomboids, flares his hands, palms like this. That tightens up the entire trap. Then we bring the head straight back in the Z-axis. And then he's a little bit right, so we're going to do exactly a mirror image of that and go left. We're going to hit his atlas right there, and I'm going to tighten this up a little bit. Okay, now just relax. I'm going to push your head forward just a little bit. We're going to reset his muscle spindles into his trapezius muscles and levator scapula muscles, and the upper rhomboids here. And then the lower trap right here. There. Now, this time when you go forward and backwards, Josh, this should feel smoother than all of them.
Very smooth.
And then neutral. Okay, look at where his neutral is now. His ear is much closer to being over his shoulder, and you can see how his shoulders have squared off. His hands are more at his sides now as opposed to being way out in front. And the end goal would be to get his shoulders squared off where his hands are right at his side. And that feels pretty good right there, doesn't it?
Feels great.
Very good. So this is your Houston chiropractor adjusting a fellow Houstonian, and thank you for sharing that with us again, Josh. And we'll see you next time.